Hi, I'm Dr. James Johnson, Medical Director of Vitreous Floater Solutions. If you have eye floaters, or you're doing some research for someone who does have eye floaters, somewhere along the line you may have come up with the question, or your doctor may have broached this question with you, which is, if this really works, why aren't more people doing it? Well, what I'm talking about is the use of an ophthalmic YAG laser to treat eye floaters. It's something that has been around for nearly 20 years, and yet for some reason it still flies under the radar. So what about that? Why aren't more people doing it? Well, I think I have some answers for this, and this is gleaned from nearly 4 years of doing this procedure and about 3 years of doing it exclusively. This is all I do. This is the focus of my practice. So let's talk about that. Why aren't more people doing this procedure? Well, first of all, I think if you go back and look at the culture of eye care, the culture of ophthalmology, floaters are generally considered benign. And for the most part, they are if you ignore the psychological impact of it. They are benign in the sense that it does not involve the retina, it does not involve the lens, the cornea, the pressure, the peripheral vision, contrast sensitivity, visual acuity. All these very important measurements are not affected by it. And the reality is when we examine the eye, unless you're really specifically looking at the floaters, it's very easy to look right through them and not be very impressed by them. So generally they're considered benign and not academically very interesting for the doctors. In addition, when you, the patient, go into the doctor for an examination with a new onset floater or a concerning floater, generally I would imagine you have three questions that you need satisfied. The first one is, what is it? What is this thing? The second question is it going to blind me? Is it going to disable me? And the third question is, well, doc, what can you do about it? How are we going to fix this thing? Well, the doctor really has a different agenda, and sometimes these things don't mesh very well. What the doctor is obligated to do is to find out, or rule out, I should say, a serious pathological condition of the retina. We'll say, is it a retinal hole, tear, detachment, hemorrhage, inflammation, scar tissue? Is there something going on that will potentially blind this person? Once they've ruled that out, the only other thing they need to do is just reassure you that it's not going to blind you and give you some platitudes of hope, reassurance, and move on to the next patient. So the patient's three questions are not really answered very well. They are often given some hope. Leave it alone. Your brain will get used to it. It'll go away. You'll learn to live with it. All these usual things that are reassuring, and the patient moves on. Now, it may be months or even years later, and maybe a couple other examinations with other doctors, and they find the same thing is told to them. The other thing is the examinations are essentially normal. On paper, on the clinic, on the chart, there's nothing really that stands out. Like I said earlier, visual acuity is normal, visual function, and people with really bad floaters are still usually very functional. They're still working, they're still driving, they're just really annoyed by the floaters. The other thing is I know that there are some doctors who have this laser in their office. They usually use it for another procedure, and they see a floater and they think, I've read about this, I've heard about this. Why don't we just try it? Come on to the back room, let's sit down, let's dilate, and they get the patient there. Without the experience, and it is a very difficult procedure, without the experience, they typically use too low energy, they don't do enough shots, they have difficulty seeing the floater, and they conclude this procedure doesn't work. And then they maybe try it a couple more times, and then they give up on it, never to be tried again. And doctors' egos, what they are, they're probably reluctant to say, gee, I don't have the skills, let me send you to somebody who does have the skills. They're more likely just to conclude that the procedure doesn't work, and then you're stuck with your floaters, and they give you no other options. What else? The other is, there aren't very many good studies. There are a few published studies that talk about the procedure. The good news is that they concluded that it appeared to be a safe procedure and there were no complications of the procedure, but the results were marginal at best. They weren't very well designed studies, I don't think. The energy levels were probably not appropriate. The strategy of treatment was probably not appropriate as well. So there isn't really good convincing studies to say, I've got to try this, this really works. They're just okay. The other is there's no formal or even informal training for other doctors to learn this procedure. It's not presented or taught at our usual continuing medical education courses and conferences, and so doctors really have to be more or less self-taught in this procedure. Well, it's hard to be self-taught in anything. It really takes a big commitment, and it's a very long and slow process to do so. So I think doctors are a bit reluctant to jump into something that they don't have somebody over their shoulder teaching and training them to do. And the reality is it's a difficult procedure to do. I used to be a LASIK and refractive surgeon, And if you go to a conference, you watch the PowerPoint presentation, you practice on a couple pig's eyes, and you're a LASIK surgeon. You may not have the experience of a more experienced doctor, but you're a LASIK surgeon. This is something that you really need to do a lot of. I think 50 to 100,000 laser shots before you really start to get in the groove. And I have over 1 million laser shots. I'm on my second laser now, and I still feel like I learn a little something from each patient. So it is a very, very long, slow course of training and self-taught. What else? It's a very time-consuming procedure. It's not unusual for me to spend 3 days in a row with a patient and ultimately have spent 4, 5, 6 hours with them, personally in the room with them. Most practices are not able to make that type of time commitment, and I don't think it's something you can zip in, spend 10 minutes, and move on with the next patient. In my hands, with my technique, it just doesn't work that way. So anyways, I hope that this is a interesting introduction, answers some very, very important questions. Again, why aren't more people doing this? Very good question, by the way. And I hope that gets you started on looking into the possibility of getting your floaters treated with the YAG laser. There are just a few of us in the country that do this and do it with regularity and do it with experience. I encourage you to do your research, watch my videos, go to the discussion forums, ask questions, talk to the doctor. I spend a lot of my time on the phone and on answering email questions. I try to make it a very personal approach. So I hope that this video presentation makes it a bit more personal for you. So thank you for watching. I know these are long, but you're probably looking for information. I'd be glad to share that with you.